If a child loses a tooth after trauma, you have less than 30 minutes to save it. One wrong move can destroy the permanent tooth forever. So what should you actually do? This is Dental Trauma in Pediatric Dentistry, made simple.
Welcome to Dental Trauma in Pediatric Dentistry. From tiny teeth to permanent smiles, trauma management is all about speed, accuracy, and confidence. Today we'll learn definitions, mnemonics, and real-life cases. Let's make it memorable. Trauma can affect deciduous or permanent teeth. About 30 to 40% of children under 5 experience dental trauma, mostly from falls or collisions. Let's start with trauma and deciduous teeth. Remember the mnemonic C, sil, ear. C for concussion, S for subluxation, I for intrusion, L for lateral luxation, E for extrusion, A for avulsion, and R for root or crown fracture. Concussion is an injury to the tooth-supporting structures without mobility or displacement. The tooth is tender to percussion, but not loose or bleeding. Treatment includes a soft diet for 1 week, gentle brushing with a soft brush, and chlorhexidine mouth rinse. Follow-up at 4 weeks, 6 to 8 weeks, and 1 year. Subluxation means the supporting structures are injured with slight mobility but no displacement. No repositioning is needed. Advise a soft diet and chlorhexidine rinse. If the tooth is mobile, apply a flexible splint for up to 2 weeks. Review after 4 weeks, 6 to 8 weeks, and 1 year. Lateral luxation means the tooth is displaced labially, lingually, or laterally, often with an alveolar bone fracture. Reposition the tooth gently under local anesthesia using finger pressure. Stabilize with a flexible splint for 4 weeks. Maintain a soft diet and good oral hygiene with chlorhexidine rinses. Follow up for up to 5 years to monitor pulp vitality. Intrusion means the tooth is pushed axially into the alveolar bone. It is the most common injury in primary teeth. If it affects the permanent tooth bud, extract. If not, wait for spontaneous re-eruption within 6 months. Surgical repositioning is avoided in primary teeth. Extrusion is partial displacement of the tooth out of its socket. The primary tooth should be extracted because of risk to the permanent bud. Avulsion is complete displacement of the tooth from its socket. Never replant a primary tooth. Discard it and reassure the parents. For root or crown fractures, if the tooth is mobile, extract it. If stable, keep on a soft diet and review. For alveolar bone fractures, apply splinting for stabilization. Remember the sequelae of trauma to primary teeth with the mnemonic DAPA: discoloration, ankylosis, pulp necrosis, and effects on the permanent tooth such as hypoplasia, hypomineralization, dilatation, or arrest of development. Now let's move to trauma in permanent teeth. Remember the mnemonic, every crown root really painfully suffers. E for enamel fracture, C for crown fracture, R for root fracture, R for repositioning or luxation, P for periodontal trauma, and S for severe injury like avulsion. Enamel fracture is limited to enamel only. Smooth the edges or restore with composite. If a fragment is available, bond it back. Take radiographs to rule out other injuries. Follow up at 6 to 8 weeks and 1 year. Enamel dentin fracture involves both enamel and dentin without pulp exposure. Cover exposed dentin with glass ionomer or composite. If a fragment is present, bond it. Take soft tissue radiographs to check for fragments. Enamel dentin pulp fracture or complicated crown fracture needs pulp vitality preservation. For open apex teeth, do pulp capping or partial pulpotomy using calcium hydroxide or MTA. For closed apex, preserve the pulp if possible, if not, perform root canal treatment. Crown root fractures depend on the fracture line position. Options include removing the fragment and restoring, performing gingivectomy and endodontic treatment with post-crown, orthodontic extrusion, surgical extrusion, decoronation, or extraction with implant later. Root fracture involves dentin, cementum, and pulp. Reposition the coronal segment, confirm radiographically, and stabilize with a flexible splint. Splint for 4 weeks if the fracture is in the middle or apical third, or up to 4 months if near the cervical third. Monitor pulp vitality for at least 1 year. For periodontal trauma, remember the mnemonic CLELI. Can little luxations ever improve? It includes concussion, subluxation, lateral luxation, extrusion, and intrusion. All require a soft diet, chlorhexidine rinses, and regular reviews. Avulsion is the true dental emergency. It means complete displacement of a tooth from its socket. Prognosis depends on 4 factors: time out of the socket, storage medium, splinting time, and pulp vitality. The mnemonic is TSSV: time, storage, splint, vitality. If a permanent tooth is avulsed, hold it by the crown, rinse gently, and replant immediately. If replanting isn't possible, store it in milk, saline, or saliva and rush to the dentist. Never replant a primary tooth. At the clinic, clean the area with saline or chlorhexidine, apply a flexible splint for 2 weeks, prescribe antibiotics such as penicillin or doxycycline, and give a tetanus booster. For teeth with closed apices, start root canal treatment 2 weeks after replantation. Monitor with radiographs for 5 years. Possible sequelae after replantation include surface resorption, which is self-limiting, replacement resorption or ankylosis, and inflammatory resorption due to pulp necrosis. Now, let's test what we've learned. Case 1. A 4-year-old with intruded upper incisor. The management is to wait and observe if it does not affect the permanent tooth. Case 2. A 9-year-old with an avulsed upper incisor that was out of the mouth for 10 minutes but kept moist. The management is to rinse gently, replant, apply a flexible splint, start antibiotics, and follow up. In summary, remember the trauma triangle with the mnemonic DPT. Diagnose, preserve, and track. How? Diagnose the type of injury, preserve tooth vitality whenever possible, and track healing with follow-ups at 6 to 8 weeks, 6 months, 1 year, and yearly for up to 5 years. With correct diagnosis, careful treatment, and consistent follow-up, you can save smiles for life. Every tooth tells a story. Listen carefully, act wisely, and treat compassionately. You're not just fixing teeth, you're restoring confidence.
Don't stop learning. Subscribe and watch the next video for more dental hacks and real cases.